Hello, everybody. On this video, I'm going to talk to you about things that you can do that hopefully will help touch issues work better for your child and help them just be more comfortable in their own bodies. All right, so the top kind of principle here is to find touch that they like. And even if you can't find anything that they like, can you find some touch, some contact that they're at least kind of neutral with, that they can accept it? Anything that's unpleasant, I'll just want to try and avoid that. Looking for things that are at least neutral, tolerable, without a problem. All right. So every child is going to be very different, but I'm just going to give you examples of some kinds of touch, right? So we could have strokes, squeezes, presses, like when you might just press down on a finger, let's say, or on the face, you might do a press. And let's take each one of those, and I want to just give you some ideas of what you can do. So, um, with strokes, for example, uh, a stroke might be, let's just talk about the hand for a second. So imagine this is your child's hand, and you just want to stroke the whole hand like that. You could just try that and see, does your child accept that? Maybe in the middle of connecting or cuddling or something, but just try it. So one thing is you can use your hand or just use a finger to do the stroke. But another way would be if you've got a cuddly toy at home, maybe your child has a favorite soft toy and you can take the soft toy and have the soft toy stroke them. Okay? Okay. Um, a different variation on this is if your child will let you, can you take their wrist, let's say, and then guide their hand to stroke something else, either stroke you or stroke some clothes that you're wearing. Maybe it's a nice soft top you've got on, or to stroke your dog. Different sort of materials, different things. Any of these things that I'm saying, these are just my suggestions. I would, of course, what I want you to do is think, okay, we don't have a dog. I'm not sure that he likes any clothes that I wear. I want you to think what's going to work for your child. Is there something that he can accept or enjoys stroking? And just try out experiments if you're not quite sure, and just try to find ones that are at least neutral or even pleasant for him. Okay? All right. Squeezes is the next thing. So, does he like being squeezed? Does she like being squeezed? Squeezes can be squeezing individual fingers, maybe giving a few seconds gap in between each finger, and just try that. If that's too much, can you just squeeze the tip of a finger? Can you do a squeeze somewhere else on the hand? Okay. Sometimes people like squeezes on their head, different things like this. Okay. What I would suggest that you do is, like, you can show it on yourself what you want to do, right? Oh, I'd like to give you a squeeze like this. What do you think? You want to give it a go? And you give them a chance to see what you're doing, and you're demonstrating that you're just going to do just one, two, and then you let go, right? You're showing them exactly what it looks like. And I would start with something super short like that, because if their touch is very sensitive, they might be a bit nervous. Is it going to be okay? I don't know quite how it's going to feel. But showing them something really short can help them be brave and ready and open to give it a try at least. Okay. All right. Um, Squeezes can also be nice, like somewhere else on the body, shoulders, or even feet can be quite nice, or toes. So again, feel free to be flexible and try out lots of different experiments. I was showing you before presses, and usually a little bit firm is better. But again, think what's your child like? And by better, what I mean is sometimes when there's a light touch on the body or on, the hand, the face, somewhere else, that's more unpleasant for a lot of people that it starts to tickle and so on. But some people really love a light touch. So be open to both, but often firm firm touch works better for people that it can avoid the tickling, for example, right? So then uh, that might, when you combine that then with a stroke, what that might mean is either I'm just doing firm press, letting go, firm press on the finger, let's say on the fingertip here, and let go, or a firm press somewhere on the face and let go. So they're quick, but they're firm. Okay. All right. So you can try that. It may be that a press with a whole hand is pleasant. So I'm showing like this because I'm already thinking of a press on the face like that and then let go. Okay. You could try having the whole hand and stroke it down somebody's back. But again, I'm suggesting a little bit firm pressure, but we'll see. You can try out if your child prefers a very light pressure. Okay. If your child's fine with any kind of pressing like that I've been showing, maybe one step up from that as the next level to try out with them would be what I call a press and a slide, which might sound slightly strange, but what that means in practice is I do the press and then I just let it slide and then I take the hands off. So if you try this on yourself, maybe you'll see more what I'm talking about, that there's a difference in the feeling with a press, because those can be nerves which are deeper and they are registering pressure on the body, and that can be comforting for a lot of people. And then when there's movement, those might be nerves. Again, I'm presuming because I'm not a doctor, more on the surface of the skin, um, a different kind of stimulation. And again, I'm suggesting that you just do an inch or so, just doing a little bit at first and then letting go. Because if somebody's got very sensitive touch, maybe that's as much as they can manage. And that's exactly my point. I'm trying to give you suggestions here of touch that you can do with your child, but in such small doses that even a very sensitive person can accept them and manage them. And then by having daily amounts of different sorts of touch that they can manage, then over a month or 2 or 3 months, their touch can start to improve and they can tolerate more and more things. Okay, so that's where I'm going with all of this. All right, so I showed you a touch, a press and a slide on the face, and you can do the same on the hand. You just put a hand on and then let it slide just a little bit and take it off. So a good moment for that might be if your child's playing on the floor and they've got their hand flat on the floor and you can do the top of their hand. Or they've got their hand on your lap or on a table, something like that. So it might just work better if it's supported and then you can just do a slide. All right. Okay. So I want to now talk about different areas of the body because our body parts are represented differently in the brain. What I mean by that is the face and the hands, some of you may already know, have a lot more nerves, a lot more neurons in the brain that process the touch information than, say, your elbow or different other parts of the body. And we use our face and hands so much that working on touch for these two areas is a priority and can be really helpful and really useful. All right. So if your child has touch issues, like I mentioned on the other video, then I would especially if they're on hands and face, because I'm guessing that they will be, I would definitely make that a top priority. So even if your life is busy, to try and do something on face and hands, some contact every day, if at all possible. Okay. All right. Um, The head, like the scalp, is also another area, especially if your child shows you that that's a bit uncomfortable. The feet can be another area to work on, or pretty much anywhere really else after that on the body. But you can see that I'm saying that there's like a hierarchy of I would start with hands and face at least. All right, great. Maybe that's enough for right now. Thank you so much for listening and watching, and good luck with trying out any of these things. All right, bye bye for now.